Have you ever stopped to think about how you care for your body, really care for it, now that you're older? Most men don't talk much about this, especially when it comes to private areas like the penis. Maybe it feels uncomfortable. Maybe it seems unnecessary. Or maybe, like many, you were never told how much small daily habits can make a big difference as you age. But the truth is, just like the rest of your body, this part of you deserves care, too, not just when something goes wrong, but every day. Not because it's about youth or appearance, but because it's about comfort, hygiene, confidence, and your overall health. And taking care of it doesn't have to be complicated or embarrassing. In fact, it can be simple, quiet, and surprisingly meaningful. So today, I want to share 5 simple penis care rules that every older man should follow. These are not gimmicks or medical lectures. These are real, everyday things that support your comfort, hygiene, and peace of mind. We'll go over what to do, why it matters, and how small changes can quietly improve not just how your body feels, but how you feel about yourself. Before we jump in, I'd love to hear from you. Where are you watching from? Drop your city or state in the comments. I always enjoy hearing from folks across the country. Rule 1: Gentle daily cleaning. Let's start with something really basic, but surprisingly important: how you clean yourself down there. You might think, I've been doing this my whole life, what's there to change now? But the truth is, the way you cared for your body in your 30s or 40s might not be the best approach anymore. As we age, our skin becomes thinner, more sensitive, and more prone to dryness or irritation, especially in delicate areas like the groin. One mistake older men often make is using harsh soaps, scrubbing too hard, or even cleaning too often. It may seem like a good idea to stay extra clean, but overwashing or using strong products can actually damage the skin. When you strip away your body's natural oils, the skin becomes dry, itchy, and more likely to crack or develop rashes. And in warm, closed spaces like the groin, that can easily lead to fungal infections or discomfort. So what's the right way to clean? Keep it simple. Use warm water and a soft washcloth. If you do want to use soap, choose something mild, fragrance-free, and alcohol-free. You don't need to lather up heavily or scrub hard, a gentle touch is more than enough. And after rinsing, make sure to pat the area completely dry. Don't leave moisture behind, that's where irritation and bacteria like to settle in. If you're uncircumcised, gently pulling back the foreskin during washing is also important. That area needs to stay clean and dry, but again, no aggressive scrubbing. Just a soft rinse and a light pat dry is all it takes. I knew a man, Dennis, who spent years struggling with itching and discomfort. He kept changing soaps, tried powders, even antifungal creams, but nothing helped. Turned out, he was just overcleaning. Once he stopped using strong soap and switched to water and a light touch, his skin started feeling better within days. Rule 2: Daily visual check. Know what's normal for you. Here's something most men never hear about, let alone talk about: the importance of taking a quick look down there each day. Not with fear. Not with worry. Just with awareness. It's not about being obsessive or overthinking every bump or spot. It's about knowing what's normal for your body, so you can catch small changes before they become big problems. A lot of older men think, if it doesn't hurt, it's probably fine. But the truth is, not everything that needs attention shows up with pain. Things like skin infections, slow-healing sores, or even early signs of skin cancer can start quietly, with just a small patch of discoloration, a rough spot that doesn't go away, or a bump that looks different than the rest. That's why a daily glance is a powerful habit. Not because you expect something to be wrong, but because you'll know if something changes. And the earlier you catch it, the easier it is to treat, often with nothing more than a cream or a quick visit to the doctor. I remember a man named Frank, 79 years old, who noticed a tiny spot near the base of his shaft. It looked like a small ingrown hair, so he ignored it. It didn't hurt, and it didn't seem serious. But after a few weeks, it was still there. When he finally brought it up to his doctor, it turned out to be early-stage skin cancer. Because he caught it in time, treatment was quick and successful, no complications, no surgery, no fear hanging over him. Frank later told me, "I never thought to check. But now it's just part of getting dressed, takes 5 seconds. That's all it takes, a few seconds after your shower, while drying off or getting dressed. Just a quick look. That simple habit can give you peace of mind, and control. And it helps in another way too. When you check regularly, you're more comfortable bringing things up with your doctor. You're not second-guessing yourself. You know what you've seen, and that confidence makes all the difference when it comes to your health. Rule 3, Moisturizing to protect aging skin. You might think, why would I need to put lotion down there? And that's fair. It's not something most men grow up doing or talking about. But as we age, our skin naturally becomes thinner, drier, and more sensitive. And that includes the skin on your penis. Dry skin in that area can lead to itching, flaking, tightness, or even tiny cracks that hurt or make you feel uncomfortable during daily movement. For some men, it can also affect how confident they feel, even when no one else sees it. The truth is, moisturizing isn't about vanity or looking good. It's about feeling better and staying comfortable as your body changes. The key is to use the right product. You don't want scented lotions or anything with alcohol or harsh chemicals. What works best is a simple, unscented moisturizer or a barrier cream made for sensitive skin. After you shower, once your skin is clean and dry, take just a pea-sized amount and gently apply it. No need to overdo it. You're not slathering, you're just restoring what your body isn't producing as much of anymore. I knew an older gentleman, Harold, who was 82. He used to think the dryness and tight feeling he had were just part of getting old. But his doctor suggested trying a gentle moisturizer once a day. A few days in, Harold said, "I didn't even realize how uncomfortable I'd gotten until I started feeling normal again." Now, it's just part of his daily routine, like brushing his teeth. The benefit isn't just physical. There's something quietly powerful about giving that part of your body some care, not because someone else told you to, but because you still matter to yourself. You're not ignoring this part of you. You're acknowledging it with kindness and respect. So if you've never moisturized this area before, that's okay. You can start today. It's a small step that takes less than a minute but brings noticeable comfort and can help prevent irritation, especially in dry seasons or after shaving. It also shows you're still taking ownership of your health in this chapter of life, and that counts for a lot. Rule 4. Supporting circulation through daily movement. Specifically, how it supports the health of your penis. Most men don't connect the dots between circulation and their comfort, function, or sensitivity down there. But the truth is, steady blood flow is one of the most important things for your sexual and urinary health, especially as you get older. With age, it's common for circulation to slow down. We tend to sit more, move less, and develop conditions like high blood pressure or diabetes that make things worse. And when blood isn't flowing well to the lower part of your body, that can lead to weaker erections, slower healing, less sensation, or even a feeling of numbness over time. But here's the good news, you don't need intense workouts or expensive treatments to help with this. Just a little movement each day makes a big difference. Even short walks, light stretches, or gentle leg exercises can improve blood flow to your pelvic area and support the health of the nerves and blood vessels connected to your penis. There was a man I once spoke to named Robert, age 76. He started walking twice a day, just 10 minutes around the block in the morning and evening. After a few weeks, he noticed he was sleeping better, had more energy, and something unexpected, he started waking up with morning erections again. It surprised him because he hadn't made any other changes, no new pills, no strict diet, just movement. That's how powerful circulation is. You don't have to wait for motivation. Just start small. March in place during TV commercials. Stretch your legs before bed. Take the stairs if you can. It doesn't have to be perfect, it just needs to be consistent. And this kind of movement does something else too. It reminds you that you're still living, still showing up for yourself. You're choosing to be active, to care, to stay involved in your own well-being. That mindset carries over to every part of your body, including the ones we rarely talk about. So if you felt disconnected, sluggish, or unsure of what to do next, start with your feet. Get them moving. Because every step you take supports not just your body, but your confidence and peace of mind, too. Rule 5. Mindful urination and complete emptying of the bladder. More specifically, making sure you fully empty your bladder every time you go. It might not seem like a big deal, but for many older men, this is one of the most overlooked habits that can lead to a lot of frustration if ignored. As we get older, the muscles that control our bladder can weaken. The prostate can enlarge, and our ability to feel when the bladder is truly empty becomes less sharp. What happens then? You go to the bathroom, feel like you're done, but a little urine is still left behind. That leftover urine becomes a problem over time. It can cause discomfort, lead to urinary tract infections, bladder pressure, or even cause dribbling and leakage during the day. A man I once knew, Gerald, 81, thought waking up at night to pee was just normal for his age. But even after going, he still felt the urge. And during the day, he started noticing a bit of leaking that never used to happen. After talking with his doctor, he learned he wasn't fully emptying his bladder. With a few small changes, things got much better. So what can you do? Slow down. Take your time. Instead of rushing through, give yourself an extra 10 to 20 seconds after you finish urinating. Some men find it helps to sit down, yes, even for urination, because it relaxes the pelvic muscles. Others gently lean forward or shift side to side to encourage full emptying. Don't push hard or strain, that can actually make things worse. Just relax, breathe, and listen to your body. It may feel unusual at first, but it quickly becomes normal, and the relief you feel will be worth it. And here's the bigger picture: this isn't just about the physical act of going to the bathroom. It's about paying attention to your body's signals. It's about slowing down enough to give yourself what you need. That kind of awareness keeps you ahead of problems and gives you more control in daily life. So if you've been dealing with urgency, nighttime bathroom trips, or dribbling, don't just brush it off. Try these simple changes. You might be surprised at how much more comfortable and in control you feel. It's a small act, but it brings back peace, and that matters. Let me leave you with this: caring for your body, including your private parts, is not about shame, and it's certainly not about trying to be young again. It's about comfort. It's about health. And most of all, it's about respecting yourself, every single day, in quiet ways that truly matter. We talked about 5 simple habits: gentle cleaning, visual checks, moisturizing, daily movement, and mindful urination. On their own, each one might seem small. But together, they build a strong foundation for how you feel, how your body works, and how confidently you live in it, no matter your age. There's nothing complicated here. No gimmicks, no awkward steps. Just small actions that speak to something bigger, that you still matter. That your health, your comfort, and your sense of dignity are still worth protecting. And they are. Some men may go years ignoring these things. Some may feel embarrassed or unsure of where to start. But the truth is, it's never too late to begin. Even if you only choose one of these habits to add to your routine this week, that's a step in the right direction. And you don't have to be perfect. You just have to show up for yourself, one day at a time. So if anything in this message spoke to you, if you felt seen, or learned something new, or even just paused to think about your body in a different way, I'm glad. That's the goal. And I'd love to hear from you. What's one thing you plan to try after watching this? Or was there something that surprised you? Leave a comment below, your experience might help someone else who's going through the same thing. And if this helped you, please take a moment to like the video, subscribe, and turn on the bell, so you never miss content that supports you, informs you, and reminds you that aging can be done with strength, grace, and confidence. Take care of yourself. You've come a long way, and you're still worth every bit of care.